Time to visit with Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician, and he's also founder of a huge organization called Health Watch USA. Hey, good morning, Dr. K.
Good morning, Jack.
We all want to kind of think that the pandemic is over. It really isn't, is it?
No, it's not. And unfortunately, we've got new variants and cases are increasing in Kentucky. And this just isn't the case count, but hospitalizations are also starting to go up. So we really need to start abiding by public health advice. Fayette County's in the red zone. CDC recommends masking up in indoor public settings. And we need to do this because our vaccines are starting to wane. And especially with the threat of the BA.4 and BA.5 variants, these variants may be even more of an immune escape variant. And because of that, masks become much more important.
And it is also important for certain members of our society to get a second vaccine. Who are those people?
That's correct. If you're above the age of 50, you need to get a booster. And this is a second booster. And that's if you're greater than 5 months from your first booster. So when you see a lot of the data saying that, well, those that are boosted are having more hospitalizations than those that aren't, a lot of that's because the older individuals are at higher risk and they're not getting their full vaccine course. And I need to stress that they're still doing better than those who are not vaccinated. So do go out and get vaccinated. This does provide a layer of protection, especially against hospitalizations and deaths. But you have long COVID hanging out there. So this is a dangerous virus, and you still want to take measures even though you have that vaccine protection.
Now, are they recommending vaccinations for those below 5, and if so, why?
Well, they're not recommending yet, but Pfizer has submitted an application to the FDA, and this should be heard later this week. The main reason is that the kids, when they're quite young, have a potential of spreading the virus to others. And they also rarely can develop a severe inflammatory disease, which can affect them directly. Now, you'll hear, well, the children practically don't have to worry about being in the hospital or dying, etc. And that may be true, but there's still risk to others, and practically worrying about something doesn't mean their chances are totally zero. So I'll be very interested in hearing the data, both on the safety and on the durability of the vaccine, because that's been, I think, the main problem with the vaccines, is they haven't been lasting long enough. I mean, I don't want to get a shot every 5 months. They need to come up with a better plan. And I do think we have a number of vaccines and boosters that are in the works that hopefully will provide us with better protection. And the best that I'm seeing right now is the Moderna bivalent booster, which has the spike proteins or the RNA to the spike proteins of 2 different viruses. And this is supposed to be highly effective against Omicron, 8 times more effective than the original booster. So that, I think, is really good.
Now, I thought this monkeypox thing was going to be a flash in the pan, and I hadn't really heard anything about it for a while. What's up with that?
Well, I did too, and I think that it's still there. We're going to see increasing cases, and it may just mean because it's being diagnosed more. In other words, there's some evidence it's been in our community circulating for quite some time because there's already 2 strains out there. Right now, there's 49 cases in the United States, over 1,000 worldwide. The cases are going up. It's primarily spread by a men with sex with men type of a disease. There may be concerns about rarely spreading by aerosols. Some of these patients can cough. When they do cough, droplets are produced, and our understanding now of droplet spread is it's a whole myriad and spectrum of droplets, and there'll be some small ones which can aerosolize, but that's felt to be a minor mechanism of spread. It's mainly close contacts through men. You might liken it to AIDS in that it's falling into a viral type of a sexual disease that may not be that big of a threat to other people. don't know much about this virus yet, and we're still gathering data, but it's definitely a different monkeypox than what was around a decade or so ago, because you're seeing increased cases in Africa, which have occurred over the past several years after a 40-year hiatus. So it's kind of concerning. This isn't something that just came about. It's something that's been slowly creeping on that I think we just noticed. And it became really prominent when there were two large parties in Europe that resulted in large events that spread this virus. So I think we'll just need to stay tuned and we'll learn more about that. But definitely the greatest threat we have right now is COVID.
All right, I got a text while you were talking there from Matt over in Georgetown, and he asks, I think, a very good question. He said, please ask the doctor if the side effects of a vaccine for kids pose a greater risk than the actual virus.
I don't believe it does, but again, I don't want to be prejudging anything until we hear the data and the FDA hearing. But I also think what you're looking at is, well, what's the family unit like? If you've got a family unit where these children are going to daycare and you've got high-risk individuals and high-risk caregivers in your family, then that's something you may really want to consider. But certainly I would be talking with your primary care physician regarding whether this is good for you. I can tell you from what I've seen now, I will probably be recommending this for my young grandchildren simply because they're living in households that have high-risk caregivers. They're going to daycare, and almost all of the bad outcomes from vaccines will occur within 1 month. So that should be apparent in the data. And let's wait to the VA hearings and have the experts and the detractors sift through the data and tell us what they think. So right now, I'm still open.
Dr. Kevin Kavanagh, thank you, sir.
Thank you, Jack.